Are you struggling with foot pain, knee pain, or even cramping in your calves at night? It could all be coming from one thing, and that's your calf muscles. And yes, I did say calf muscles. There's actually two muscles in your calf. Most people know about the gastrocnemius or the gastroc. That's the big muscle in the calf. However, there's a sneaky one underneath called the soleus. It's much smaller and much less popular, but it can be a problem for a lot of people. Both of these muscles attach into the Achilles tendon. That's the tendon that runs along the back of your heel and attaches to the bottom of your heel. If you've ever heard of anybody having Achilles tendonitis, that is an inflammation of the Achilles tendon or the tendon that we're talking about here, which means that tightness in the calf and the Achilles tendon can lead to plantar fasciitis, which is pain in the heel that goes along the bottom of the foot, or pain in the knee, especially with walking and squatting. I'm Dr. Amy, PhD trained in orthopedic manual physical therapy, and I believe that movement is life, and you deserve both. First off, we're going to start talking about why your calves might be tight in the first place, how the foot and the calf and the knee are all connected, some other things to consider if you're struggling with calf tightness, and then we'll finish off by showing you my favorite calf stretch. All right, signs that your calves might be too tight. If you suffer with heel pain or have plantar fasciitis, it could actually be coming from a tight Achilles tendon and tight calf muscles. If you suffer with knee pain during running or squatting, that could actually be coming from your calf. If you struggle with cramping at night, some people will have cramping that even is so bad it wakes them up at night, that's from your calves. Or if you notice that you tend to walk more on your toes than on your heels, or you're not able to bring your toes back towards your head. That motion is called dorsiflexion. And if you're not able to lift your toes up off the floor or lift up your foot from the floor, it could be due to tight calves. So how is the foot and the calf and the knee all connected? Well, if your calf muscles cannot lengthen properly, this changes actually the biomechanics in your foot. If that happens, it can cause the knee to move incorrectly, trying to compensate for the tightness in the calf and the poor biomechanics in the foot. Or it could lead to limited ankle mobility, which will cause overuse injuries up and down the chain. Now, if you tend to have cramps that happen at night, maybe you're fine during the day, you're like, Dr. Amy, I can pick up my toes from the floor, no problem, but I just get this cramping that wakes me up in the middle of the night. What you may be suffering from is actually a magnesium deficiency. So you may want to be taking some magnesium orally. There's also lotions that include magnesium that you can put on your calves. You still want to be doing stretching before you go to bed to decrease tension in your calves. But adding magnesium can specifically help with those muscles directly. In my house, because we run so much, we take magnesium in the morning and put magnesium lotion on at night. And it's critically important that we talk about the hydration factor. Friends, if you are not drinking enough water, all of your muscles have the chance to become tight, especially the calves. You need to be drinking at least 80 ounces of water a day to ensure that you have enough water to keep your muscles healthy. Dehydrated tissue leads to less flexible tissue. And a lot of people will ask me if they need to add electrolytes. If you live somewhere where it's very hot or you do a lot of activity during the day where you're sweating, you may need to add some electrolytes in order to help that water get properly absorbed. Now, I promise that we are going to talk about those stretches in just 1 second here, but one more thing I want to mention before we do, and that is the importance of the psoas muscle. You see, the psoas muscle is up at the hip. It's actually a hip flexor. So that means bringing your knee towards your chest. That's what the psoas does. So when the psoas is tight, it actually forces your body to lean forward a little bit, which can increase tension in your calves. So you may have less effective stretching in your calves because your psoas is actually tight. Or you may feel like you're constantly trying to stretch your calves, but you're never seeing any improved flexibility. If that sounds like you, we are going to link a video at the end of this one so you can stretch your psoas. But now it's time to show you how to stretch your calves. All right, so this is my absolutely favorite calf stretch. It's the one that I do every single day. And I'm going to show you first on my right side because that would be my normal side. My left side, I actually sprained my ankle 5 months ago, and I am still working through that. It definitely looks much better than it used to. I can guarantee you that. And I have gotten back to running. However, it's still struggling with some of that calf tightness, which is why I need to make sure I do this stretch on a daily basis. So I'll show you what that looks like from side to side because you may be struggling with some kind of injury like that as well. First off, you want to be somewhere stable just so you have something to lean on. You're not going to be leaning on it very hard, but just to maintain your balance. You're going to put one foot back behind you as far as you need to do that runner stretch. Now this one you've probably seen before. This is not a super unique one. You do want to make sure your heel's down. You can have your foot all the way back here, but if your heel's not down, you're not stretching your calf. So you got to make sure that heel is firmly planted on the ground. And that feels like a really good calf stretch to me. Now here's the secret sauce, friends. What you're going to do is you're going to hold this position for 10 seconds. And then after you do, you're going to keep everything in that same position. So heel still down, everything staying in the same position, and you're going to bend that back knee. Now, when you do that, you're going to feel where you're stretching change a little bit. This stretch emphasizes more the soleus, which is that small muscle that's underneath the gastroc, and it is going to be a game changer for you. I promise, friends. So we're going to do 10 seconds, typical runner stretch. After the 10 seconds, we're going to do that soleus emphasizing stretch. And we're going to hold that for 10 seconds as well. We're going to do a total of 3 cycles of that. Now, I'm going to show you what that looks like on my left because my left is not going to move as well as my right, I don't think. Yep. So right there, it's already harder to get my heel down. Okay, so that's my typical runner stretch. Actually, I'm going to move that up a little bit, because that's just feeling like a little bit too much of a stretch. And I know I'm not going to have any flexibility to bend my knee. After I've held that for 10 seconds, I'm going to bend that back knee. Now you can see that's just a little baby bend, right? There's not much happening there, but I can tell you I feel a pretty big stretch with that. And I'm going to hold that for 10 seconds, and then I'm going to switch back 10 seconds. This is emphasizing the gastroc, and this one is emphasizing the soleus. Now, a lot of people will ask me how many times per day should I stretch my calves? Since it's a pretty simple stretch to do, when I am really struggling with one side being really particularly tight, I'll do it several times through the day. I'll do it usually about 3 to 5 times per day to make sure that I'm keeping that calf super flexible and healthy. But for you, if your calves are overall pretty normal, I want you to make sure that you're doing it at least once per day. And I want you to notice if it changes from day to day. So with my calf that I sprained, after I go running, it definitely gets tighter. So on days that I run, I have to stretch it 3 to 5 times. However, if I don't run for a couple of days, usually I just have to stretch it once, and then it stays pretty flexible throughout the day. Now, if you are someone who's like, that's great, Dr. Amy, but I've been stretching my calves for months, years, decades, and I still don't find relief that lasts for long term, then I'm going to have you check out this video over here, because that's where we're going to be talking about how your psoas tightness could be leading to your calf tightness and what you can do to treat that psoas tightness. If this video has been helpful for you, please give it a thumbs up and don't forget to click subscribe.